My name is Ibrahim Yahya Zango. I am the father of Fatima Yahya Zango, a patient that came to India for medical treatment regarding sickle cell disease. Sickle cell is a genetic disease, so at birth we were told that Fatima is SS. And because we have a child earlier, our first child, who is also SS, it was not a difficult thing for us to understand and appreciate. So yes, we got to know Fatima's condition from birth. The history of investigations on the condition of Fatima started very early. So from the hospital that she was born, actually she was born at home, but was taken to the hospital. And she was diagnosed as having sickle cell at age 3. And we were all surprised that when we were told that she has sickle cell. Because at age 2, we have gone to a medical laboratory in Nigeria and had inquired about her genotype, and we were told it was an AA. But in Saudi Arabia, when I was posted there as a foreign service officer to the Nigerian embassy in Riyadh, Fatima fell sick and she was diagnosed as having sickle cell disease. We were all shocked. We couldn't believe that Fatima, who had been diagnosed earlier as being an AA, was actually an SS. So that was the beginning of our shock. And then she was having treatment in respect of a seizure that she has started experiencing. And that's how we now came to discover that she also has sickle cell. So she was placed on the usual management prognosis of folic acid and all that, so that she can maintain a good health without infection. But that's how we moved from Saudi Arabia to London on an official transfer from the Nigerian embassy in. Fatima's treatment and test continued, but what we had been made to understand is that sickle cell is a disease that is without cure. And so we just have to manage it to see that the girl remains healthy so that she doesn't have to have any crisis. We had been managing on that all the way until Fatima grew to be a university student. Mr. Philip of the American University of Nigeria Clinic discussed with Fatima, and he asked her to tell her father to contact him if we are interested in her coming over to India. She persuaded me to actually talk to Mr. Philip, and I did talk to Mr. Philip, and Mr. Philip now gave me the contact number and email of the president of Doctors Beyond Borders, Mr. Varun Arora, and he asked me to link up with him, that he will be able to help me in the process of getting the right professionals in India that can help me with the treatment of my daughter. So I approached Mr. Arora and I told him that I have this patient. He asked me to give him a full report about the medical condition I'm talking about. I sent him that report. He recommended Dharamshila Hospital in New Delhi. I said, okay, I reviewed their own CVs and their own professional standing. I sought for second and third opinion from a colleague medical doctor that is working at in the UK. And a friend also, I referred the matter to him for review, who is also a medical doctor working in the US. They both gave me the confidence that they are professionals that can be able to look into Fatima's situation. And then I got back Doctors Beyond Border. I told them that I'm willing to go on this. And they said, okay, they could help me with the visa process as well. So I sent my passport, Fatima's passport and her mother's passport, and they commenced the process of introduction letter to the Indian High Commission in Abuja. And they followed up to ensure that we got the visa as swiftly as it can be. And we were able to get the support of the Indian High Commission in Abuja, and we got the visas and came over to India. Before we left, before Fatima and her mother left for India, we were also given the various accommodation options that are available by Doctors Beyond Border and how we want to proceed. And then we picked our choice of accommodation. We conveyed our ticket date of arrival in New Delhi, and we were assured that someone is going to be at the airport to personally receive Fatima and her mother and to bring them to either the hospital, depending on the time they arrive, or to the house where they will be staying. And I had been in constant touch with Mr. Ekant, Doctors Beyond Borders. He received them, took them straight to the hospital, where Fatima was admitted straight away. And then her diagnosis commenced. Investigations were done, and they stayed in the hospital for a couple of days before they moved to the apartment where they will be staying. All this was arranged and set up by the Doctors Beyond Borders. So I have absolute confidence in the process of their logistics support that they rendered to me, in addition to the professional support of connecting me with the appropriate professionals in India that can handle my situation. When my family arrived New Delhi and arrived at the Ramshila hospital, and the investigation commenced, my wife updated me about her assessment of the situation. The hospital is excellent and first class, and the doctors were so supportive, professional, and the medical staff in the hospital were fantastic. And I was so impressed from the distance I had that they were in good hands. They were in the best hands they can be. And I suddenly relaxed and resigned myself to the fact that I need to do what I have to do to support my family to find a lasting solution to this problem. Now that the transplant has been done and has been successfully done, Fatima is a new child. Fatima is born again, as we say in Nigeria. Here is that a girl that has come in as a sickler is now going back to Nigeria completely cured. She is not the same person that came here, and I have seen it manifest in her. She's so happy, so excited, and so glad that she has left her sickle cell behind, that she has moved on. And this is what I had always wanted to see in my daughter: confident, very determined with life, and very happy. Sickle cell disease is no longer the monster that it used to be. People are no longer afraid of it because the medical facilities exist for its cure. My daughter is cured of this disease. I'm confident that if we confront this disease, we can see the end of it. And I think it is something that I will want to see happen. I will do all that it takes to encourage people to come for a curative treatment. It is no longer an issue of managing the disease. It just has to be cured. And there are facilities, and the earlier we start that, the better. I wish I had done this for my daughter 20 years ago. She would have been a completely different person. And the earlier, once you discovered that the child is sickle cell disease, you should go for the cure. Do not have to waste your time trying to manage it It should just be eliminated. And the best way is to see the medical professionals that are capable of doing that, and they will do that. Doctors Beyond Borders had been central to everything I have gotten for Fatima. They helped me locate the professionals. They provided logistics for my family to visit India. They were there for me all through. They have not left me all through the treatment. They are still with me. I have found home in their hands. They have stood around me and with me and my family all through. The support that I got from Doctors Beyond Borders couldn't have come from my own efforts. I wouldn't know where to start. It's like looking for a needle in a haystack. You are not very likely going to be successful in a millions trial because they are professionals. They know where the professionals are. They are Indians. I'm not Indian. I came to India. I will be glossing in the dark. I will be groping in the dark, not knowing where to go. But they are there. They give me, they shine the light for me to follow. And that is so much of a support. I can't ask for more. It is a wonderful support that you will not be able to go through alone. As a stranger, someone who has no idea where these things are. Even in the world of internet today, it wouldn't have been as easy. We are dealing with people who know people. We are not just dealing with people we meet over the internet. We are dealing with people who know professionals, who have experiences handling guests and international travelers coming in. They are priceless.